Hey. 8-bar corner pocket, calling all the shots, boy. Raw denim, 5 pockets, feeling like a hot boy. Y'all tripping, I was in the crib watching Top Boy. Chopping up this green, guess I got a thing for Bok Choy. Ain't worried about your playlist, bruh. I need an alias, I need a foreign passport, and a change of radius. I don't pay them, but I don't save them, I ain't the glaciers. Need 2 chains like Def Jam to change the glaciers. Titanic crash against flaws, you know my wave crazy. Put over with no ID, look like cocaine 80. Same kid with stripes like a ref's average shirt. Got the next magic verse, got my chest tatted first. Treasures, Antioch stores make desperate measures. Back when you had a 1-up when your shirt said pleasures. Was in the church like elders, was underground like shelters. Made a plan to get it and kept it together like welders. I'm living stress-free, never catch me, never test me, oh no. I'm living stress-free, never catch me, never test me, oh no. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. Whoa, 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 whoa. All black leather now, my vibe much better now. My tribe said I'm the one, my time feel extra now. My instincts dialed in, my senses is dialed up. My sentences chime in, they eyebrows rise up. I feel like a titan writing the scripture. My might is touching the mixture, designing the holy picture. Reminisce on tradition, my fighting the heart with the knockout. Genesis definition of light when God told me pop out. With a smile on my face upon my arrival. It's a difference when racing for your survival. Think I'm poised to win it. Checker flags, waving Nipsey Honor. Drinking Chardonnay with my little mama banging Rihanna. Icons of this time that we live. I'm facing my every fear. I'm taking time to be still. I'm breaking down every barricade as I wait at the pier. Still waters run deep and I swear it's great to be here. I'm learning patience this year, chasing greatness this year. I'm making statements before they happen, creating this year. I seen love leave and I seen hatred appear. And my ears adjust to the silence, the snakes I can hear. But it's never scary. The DNA of God hereditary. We all in the same class, but the lessons vary. Old school ambition, but painted extra cherry. Receive the fruits of my labor, I think it's necessary. I'm living stress-free, never catch me, never test me, oh no. I'm living stress-free, never catch me, never test me, oh no. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. Whoa, 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 whoa. Whoa, 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 whoa. Whoa, 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 whoa.
Wait a minute, feeling kinda lonely, I could use a little something. Room is spinning, where I'm living, feeling kinda lonely, I could use a little something. Don't give me up, I seen the light. I see the reason in the night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. And my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah, my heart gets cold, I need you when the lights go low. No love wasted if you take it. If you feel a little lonely, I could use a little something. We could make a new beginning. Feel a little lonely, I could use a little something. Don't give me up, I seen the light. I see the reason in the night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. And my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah, my heart gets cold, I need you when the lights go low.
Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God, with what little pride I can salvage, I'll just pick up and go. Trying to sing to your heart, you went straight for the throat. Know you fronted the bill, but now we divvy the quote. That's time spent with nothing to show. Hard to stomach, I know. Manipulation we didn't need to deploy. But you playing with my vision like you think it's a toy. A product of pain, your demons bleed through the noise. Nothing but a host you sent to seek and destroy. Just a reminder to clear your mind up. This ain't no size up and not a fair fight. Neither the bodies start to pile up, let's put that behind us. No looking back or looking down, and forever to meet again, it'll probably be on a cloud. It's the principality, love, not keeping count. My default is sugar-free, when in doubt, I was bleeding out. Clear the scene, nothing to see, nobody to blame here but me. Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. Just by a show of hands, who could really leave it to chance? Seen some good kids die before Kenny in the van. Grieving on the spectrum, they may never understand. With all that, still sticking to the plan as far as where I land. So aiming for the sky, praying we're aligned. Don't pass me by, I'm alive on the far side. They got the means to move the finish and the start line. So what's a steep fall from a hard climb? So up the mountain I go. No time to explain, I paint it vivid if I make it back home. Bob Ross on every beat, I put the pain in the song. Breaking down the game film, trying to see what went wrong. So the loss matters more than the win. Then living with regret like you didn't pull the pin. Hand grenade in the shade, slow dancing on the limb. For what it's worth, I do it all again. Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God.
Wait a minute, feeling kinda lonely, I could use a little something. Room is spinning, where I'm living. Feeling kinda lonely, I could use a little something. Don't give me up, I seen the light. I see the reason in the night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. Yeah, my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah, my heart gets cold, I need you when the lights go low. No love wasted if you take it. If you feel a little lonely, I could use a little something. We could make a new beginning. Feel a little lonely, I could use a little something. Don't give me up, I seen the light. I see the reason in the night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. Yeah, my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah, my heart gets cold, I need you when the lights go low.
Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God, with what little pride I can salvage, I'll just pick up and go. Trying to sing to your heart, you went straight for the throat. Know you fronted the bill, but now we divvy the quote. That's time spent with nothing to show. Hard to stomach, I know. Manipulation, we didn't need to deploy. But you playing with my vision like you think it's a toy. A product of pain, your demons bleed through the noise. Nothing but a host you sent to seek and destroy. Just a reminder to clear your mind up. This ain't no size up and not a fair fight. Neither the bodies start to pile up, let's put that behind us. No looking back or looking down, and forever to meet again, it'll probably be on a cloud. It's the principality, love, not keeping count. My default is sugar-free, when in doubt, I was bleeding out. Clear the scene, nothing to see, nobody to blame here but me. Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the trauma.
Stress free. Hey. 8-bar corner pocket, calling all the shots, boy. Raw denim, 5 pockets, feeling like a hot boy. Y'all tripping, I was in the crib watching Top Boy. Chopping up this green, guess I got a thing for Bok Choy. Ain't worried about your playlist, bruh. I need an alias, I need a foreign passport, and a change of radius. I don't pay them, but I don't save them, I ain't the glaciers. Need 2 chains like Def Jam to change the glaciers. Titan and crash against Floss, you know my wave crazy. Put over with no ID, look like cocaine 80. Same kid with stripes like a ref's average shirt. Got the next magic verse, got my chest tatted first. Treasures, Antioch stores make desperate measures. Back when you had a 1-up, when your shirt said pleasures. Was in the church like elders, was underground like shelters. Made a plan to get it and kept it together like welders. I'm living stress free, never catch me, never test me, oh no. I'm living stress free, never catch me, never test me, oh no. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. Whoa, 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 whoa. All black leather now, my vibe much better now. My tribe said I'm the one, my time feel extra now. My instincts dialed in, my senses is dialed up. My sentences chime in, they eyebrows rise up. I feel like a titan writing the scripture. My might is touching the mixture, designing the holy picture. Reminisce on tradition, my fight in the heart with the knockout. Genesis definition of light when God told me pop out. With a smile on my face upon my arrival. It's a difference when racing for your survival. Think I'm poised to win it. Checker flags, waving Nipsey honor. Drinking Chardonnay with my little mama banging.
Hello, everyone. I'm hoping everyone can hear my voice. Yes, there you go. Thank you, Mom Jenica. And Mom Jenica, I'm trying to transfer you to panelists as well, but for some reason I'm not able to, so I don't know how this one would work later on when you're about to present. So yeah, but oh, there you go. I think there, I see now, Mom Jenica, you're in the panelist, so that's good. So again, welcome everyone to our live webinar. And this webinar is around how can you immigrate to Canada as a healthcare assistant. So this would be a very interesting webinar. There'll be a lot of things that you guys will learn, and it might not just be for healthcare, but also for immigration purposes on how to come to Canada. So yeah, so get your, if you want to take notes, happy to, of course, that would be great. And if you want to take a picture or screenshot just to save the page, that is very much allowed as well. And also at the same time, if you have any questions, right? Any questions that you might have, please feel free to enter it in the chat box or in our Q&A portion, in our Q&A. Okay. And maybe I can share my live video just for you guys to know who's talking behind this webinar. Okay, so there you go. All right. So it's a very large group. It's more than 25 participants, so that's great. So this would be a very, again, a very informative and welcome your questions, your Q&A, your questions. Pretty sure will be the questions of the other panelists as well. So let's go ahead and get this started. So my name is Israel Roman, and I am one of the hosts for today, and I am your licensed immigration consultant. And I'm based here in Canada. I'm here in Nanaimo, British Columbia, and it is July 22, around 7:06 p.m. And at the same time, I'm also an active registered nurse. So I came here in 2008 as a registered nurse, and since then I've been working as a registered nurse. And at the same time, along the way, I became a licensed Canadian immigration consultant. And we have our offices. Our main office is here, Nanaimo, BC. And we have our Philippine office, which is in President JP Laurel, Lipa City, Batangas. Okay. So our credentials. So I am as I've said earlier, I am a licensed Canadian immigration consultant, and this is through the Immigration Consultant of Canada Regulatory Council. So if there's any nurses out there, this is similar to when you are registered or licensed with PRC or the Professional Regulatory Commission. It's the same thing. So as a immigration consultant, I had to take the immigration course, had to pass the course, of course, and then take the licensure exam and stay active and in good standing with my regulatory body, which is the ICCRC. And at the same time, I am also associated with Roman and Associates Immigration Services Limited. And if you go to the Canada Business Registry, and you can search for our company, Roman and Associates, and you will see in there that we have an active BC company registration. Okay, so we are not a overnight business. We have been here for years, and again, we are registered. We have permits to operate. And at the same time, as I've said, I am a practicing RN in Nanaimo, BC. So I mean, after this webinar, you can go ahead to Google or any web browser for that matter, and you can go ahead and search Israel Roman Nanaimo, Nanaimo, and you'll see in there, you'll be able to see something about me, right? And yeah, and then you can compare it on the webinar, the video in this webinar, And the pictures that you'll see in the Google or whichever web browser you'll be using, and then you'll see that I just want to make sure that you guys are at ease in terms of, hey, who is this person really talking behind the webcam, right? Because I know there's a lot of angst in terms of, yeah, I've heard this one before. I have paid thousands of dollars, and look at me, I'm still in the Philippines, right? And I got scammed, kind of thing, right? So of course, I want to make sure that you guys are confident that you are dealing with someone legitimate. And that's why I am showing these credentials to you guys so that you can also do your own research and not just rely on what I'm saying, right? So you can search for my license with ICCRC. You can search for our company in Canada Business Registry, and then you can search for myself in any web browser. Just again, type in Israel Roman. Yeah, and you might see in there, you might not find really Israel Roman as a registered nurse. What you'll see in there is something along the lines of like manager for a department in the hospital that I work in. Okay. So work as a healthcare assistant in Canada. So how would you normally do this one? How can you work as a healthcare assistant in Canada? So in BC, in order for you to be able to work as an HCA, you need to register with the BC Care Aid and Community Health Worker Registry. You won't be able to work as an HCA in a public setting, right? Or in a facility that's affiliated by the health authority without being registered with BC Care Aid Community Health Worker Registry. Okay, so that's the first thing. So how do you register? As an internationally educated healthcare professional, internationally educated, or any graduate for a healthcare assistant, right? The one thing that in order for you to be able to start the application is that you need to be a resident here in Canada. All right, you need to be here in Canada before you can log in you can lodge a application to be registered, right? So with this one, yes, it doesn't make sense, like, right? That means since you guys are not in Canada and not a permanent resident or citizen, then there's no way for you to come here to come here and work as a healthcare aide, because you won't be able to register with BC Care Aid and Community Health Workers. That is correct, and that's why Roman Associates and Stenberg College is here for that reason, is to help you navigate this one, right? There's a way on how you'll be able to be here in Canada, and at the end of the day, be working as a healthcare assistant. So what now, right? Knowing that, okay, I'm in the Philippines, I need to be there as a permanent resident or citizen before I can register. So what now? So how can I do it? So with Stenberg College and Roman Associates, this would be your answer to your question. And how? So the best option to come to Canada as a healthcare aide is to apply for a study permit. Okay. And it would be the course, or the program would be the healthcare assistant program. Okay. And then what will happen then, right? So, okay, I've completed the HCA program from Stenberg College. So what now? Then you will apply for your work permit with LMIA, right? Then you can go ahead and apply for your permanent residency. Or some students, what they do is if they have a nursing as their background, they continue on to study the other programs, such as postgraduate diploma in Canadian nursing or the early childhood education. Okay, and we will Janica later on will go ahead, will mention more about how can you transition from a study permit to a work permit, right? So the program was meant for students to study the program, and at the end of the day, at the end of the course, have an employer that would sponsor the student for their work permit, which will lead them to their permanent residency. Okay. So this is the best way for you to be able to come here and end up working as a healthcare aide, right? So just to give you a background on what is the hourly rate for HCA, how much is the hourly rate? So this is an example of a job posting for a healthcare aide within the Nanaimo Regional General Hospital. And in that square red rectangle in there, it says the salary range is 25.83. Okay, so that is the starting wage of an healthcare aide. Okay. And okay, so let's go ahead and do a sample computation then, okay, for that wage. So if you are earning 25.83 per hour times 40, that would give you $1,033. Okay. In a month, so that's 4 weeks. So we just multiply 1,000 times 4, that would give you 4,132.80. And if we multiply that to 52 to make it a year, 52 weeks to make it a year, that would give you 53,726. Okay. You might say, okay, that seems to be a low price for me to go to Canada and study healthcare aid and end up working as a healthcare aide and only earn $53,000. So if we convert this one to Philippine peso, this one right now at 35, I know the rate right now is 39, 38, 39. So I'm just being conservative. $1 equals 35 pesos. This one would give you 1.8 million pesos a year working as a healthcare aide. Okay, so my question to you is that whatever your profession is at the moment, do you think in a year you'll be able to earn close to 1.8 million pesos? If you are a nurse working 7 days a week, I hope not. Do you think at the end of the year you'll have 1.8 million pesos? And I think I know the answer to that one, which is a no, because I've been there before. I've been a nurse back home, right? And so long time ago. And yeah, so there's no way that I'll be able to earn 1.8 million pesos as a nurse. Okay. So with this one, this is a good thing for you guys. This is good news. And this is the best time to do it, to come here, because we are looking for healthcare aides. There is abundance of vacancies right now, wherein the government is not able to fill all the vacancies, and they're not able to, I mean, like, they cannot solve the problem at the moment, right? So there's tons of vacancies. So we are waiting for you. Okay. So now that one is a healthcare aide, right? So probably healthcare aide working in a long-term care facility or in a hospital setting. But what if you would like to work in a private home as a in-home caregiver? What would be your pay? So right now in Canada, the median wage is 16.85. And you can see there, Alberta is 18.65. British Columbia is 19.56, and so on, right? But for now, we'll be conservative and just use 16.85. So if we use 16.85 to calculate your wage as a in-home caregiver, that would give you, in a week, that would give you 674. And sorry, in a month, that would give you 2,696. And if we again multiply that one to 52 to make it a year, that would give you 35,048. Okay, so it's a bit lower than being a healthcare aide, but in Philippine peso, how much is this? This is still 1.2 million pesos, right? So same question as earlier, as whatever your profession is at the moment. If you're and if you are a nurse, do you think you'll be earning 1.2 million pesos in a year? Right? And again, I think I know the answer, and again, that's why this is sorry, this is a good thing, right? A good news for you guys, and the time to act is now, right? While there are abundance of vacancies for sure, right? I've been in contact with Stenberg's owner and been asking, when will the students be ready for me to hire, right? Because I need them. I need them in our hospital, Nanaimo Regional General Hospital. And that's only one hospital. There's tons of hospital in BC or long-term care facilities that are desperate, right? I mean, like in a long-term care facility that I also work at, is like 16-hour shifts are normal. Like the regular shift is 8 hours, but then because of the vacancies, it's very normal for them to take overtime, another 8 hours of overtime, right? So when we say overtime, right, we go back to the let's say the $23. So when it's overtime, you are now earning $46 per hour. So you multiply that one to times 2. That is your hourly rate in overtime, as overtime. Okay. Sorry. So what are the advantages in joining with us? So Roman and Associates and Stenberg College. So first off is that we are in partner with the college that delivers exceptional education, right? They know what Stenberg College knows what you need. And that's the reason why they built this program, right? They didn't build the program because they want the program. They built the program around you, right? So they have done research and development on this one, that what are the things that the care aides or the students or the health care aides are looking for, right? How can foreign national come here as healthcare aid, right? So research has been done on this one, and that's why it is a very successful program, because it was built for people like you, or it was created for foreign nationals like you. Of course, we have a very reasonable administrative fee to get everything started. And we also have right now, for this webinar, for this live stream, we are offering 50% off on our professional or consultant's fee, right? So as your immigration consultant, the rate for doing your a strong strong study permit application we are only charging, or we only have, yeah, there's a discount of 50%. Okay. And for now, there is no additional professional fee for your spouse or dependent. So if you are coming with your spouse or dependents, there is no additional fee for that one. Normally there is, but for now, just for this webinar right here, there's no additional fee for your spouse or dependents, even though there's a lot of work that needs to be done for their paper as well. We are not charging anything for now. So I'm hoping that you will take advantage of this as well. And IELTS is not needed, right? So this is one of the popular question. Can is IELTS waived? So Mom Jenica later on will give us more information about this one. Job security. So as I have said, after your study permit, you will be able to, you'll have employers lined up and will be sponsoring you for your work permit. And I'm one of them. And multiple options to stay in Canada post-study. So you don't have to go back to your home country after you complete your program, right? So you can continue on staying in Canada, either as a under a work permit or other avenues, or you can also continue on studying, right? There's other great programs that Stenberg College offers. So if along the way it interests you, then yes, you can go ahead and stay in Canada and to study other programs. So once again, with Stenberg College and Roman in Associates, this would be your answer to immigrating to Canada. And with this, I will hand the Zoom floor, or yes, I'll hand the floor to Mom Jenica.
Hello, good morning, everyone. Hello, Sir Sorel, good morning. So thank you for the introduction, and that was really a lot of information you shared with us. So that's really helpful to our attendees today. So good morning, everyone. My name is Jenica Licerio, and I'm the Director for International Admissions and Recruitment for Southeast Asia at Stenberg College. And just like you, I'm based here in the Philippines. I'm working from home. So, maulan na umaga sa lahat. And I do apologize in advance if there are any background noise. I'm just saying ahead of time. All right, so let me just share my screen with you so that I can give you the presentation for our institution. So let me just... Okay, first of all, before I share the information, I'm just going to play a very short video for you. And this is the introductory video of Stenberg College. So I hope you enjoy. Okay, so welcome to the presentation. So I'll be sharing an overview of our institution. I'll discuss the healthcare assistant diploma program, and we will have our Q&A later on. So first of all, let me introduce our institution. Our school's name is Stenberg College. Okay, so Stenberg College started back in 1990. We are a private post-secondary college. We were founded by Mary Jane Stenberg, who started delivering nursing programs. So those are the first programs that we delivered. We've been really successful at it. We have the very first out-of-province lab, which is located in Alberta. And Stenberg College was acquired by Tech Global, which is an education company, after about maybe 10 years of delivering medical programs. So we're a really well-known medical college in Surrey, British Columbia. So we've been doing that for over 30 years, and we've expanded into other industries as well. So aside from medical programs, we also deliver education, business, and human services programs. So I've mentioned earlier, our location is in Surrey. So if you're not that familiar yet, Surrey is a suburb of Vancouver, and Vancouver is the largest city of British Columbia. Now, British Columbia is located in the westernmost part of Canada, and it is really known for its mildest winters out of all the provinces in Canada. Now, the great thing about living in Surrey, or starting off in Surrey as an international student, is that you have the access to a lot of the opportunities. Okay, Vancouver is just about 40-minute train ride away from Surrey. So it's actually the second largest city, and you have different races and cultures. There's a lot of international students, and you will also be saving a lot because compared to Vancouver, the living cost in Surrey is about 21% lower. So, of course, gusto natin yan kung saan tayo makakatipid. The campus itself is in downtown, so it's just right in front of the Central SkyTrain station. There are bus stops up front as well, so it's a very accessible location for students. Now, one of the things that we really take care of at Stenberg College is our employer and industry relationship. So this affects our students and our graduates. I'll tell you more about it later on. And we also have online learning available. Now, once you become part of Stenberg College, we are big on student success. We want to make sure that when you enroll with us, that we guarantee your success afterwards. So when we say success, we're not just talking about academic success, but we're also talking about being employed. Okay, and for international students who would like to have a stay back option and permanent residency pathway, that we are able to support that as well. So we have a lot of services and support systems in place for our students. So some of which are, number one, we have student services. So once you arrive in Canada, they're the first group of people that you'll be speaking with. If you have any questions or maybe any assistance that you need, you just need to speak to our student services and they will redirect you. We have career services. So career services, normally they create events or workshops that help the students gain lifelong skills, like creating your resume, acing your interviews, so that sort of thing. And we also invite employers over. We also have academic support. So being an international student, we may be used to a certain type of program delivery. Assessments might look different to us. So we want to make sure our students are well supported. So if they need to do one-on-one sessions, we do that. We have free classes, especially for communication skills. Also, we maintain a small class size because we want to make sure that, within the class, students are really given the attention, the proper allocating time for each student to check in with their progress. So we maintain a small class size, so there's more engagement when the students are studying. We also have immigration consultation support, and this is where our Roman and Associates come in. So we partner with immigration consultants, just like Sir Israel. And if you need to talk to him while let's say you have your classes, you want to schedule an appointment with him, we can help you with it, and just let us know what you need, and we will coordinate that meeting. So in relation to the career services, we also have co-op, practicum, and job placement support for the students. So when we say co-op, this is your cooperative work experience. It's part of your curriculum. Here in the Philippines, it's more commonly known as internships or OJTs. Okay, it's part of your program. You have to meet X number of hours in order to complete the whole program. So that's co-op. And the best thing about our co-op is that you don't need to look for an employer anymore. Okay, we just place you with an employer and you practice what you've learned, and you are going to get paid. Our co-ops are all paid, and it's not just allowance, it is as per industry rate. Okay, we also have practicum. Normally, when a program has a co-op, it also has a practicum embedded to it. Normally, it's for 8 weeks. So when we say practicum, it's more of a shadowing with your instructor. So you'll be given tasks, and then your instructor will be there and will be giving you a direct feedback after the task has been completed, so that you know how to do things, right? So this is more of honing your practical skills before we place you to the co-op. And of course, we have the job placement support. Again, as I've said, we have a lot of employer partners, okay, that helps with the job placement. Lastly, we have accommodation assistance. So just to clarify, our campus is located in the city center, so we don't have a dorm on campus, but we partner with homestays. So this can be an option for you for your accommodation. So homestay is a family basically hosting your stay. They probably have an extra room that they rent out. And this is a great way to really know the culture, to really live in the culture, to know who Canadians are, their practices, their way of living. So it's a great way to really be immersed into the culture. So that's one accommodation option that you can have. Some of our students, they want to be introduced to their future classmates so that they can do shared accommodation. So that's something that you can do as well. You just need to let us know what assistance you need before you travel to Canada. So now that you have an idea of who we are at Stenberg College, let's proceed with the program. It's called Healthcare Assistant Diploma International with Co-op. So there's a lot that Sir Israel already shared with you about healthcare assistants. So you already have an idea what healthcare assistants do. But just to also let you know that there are different names for it. Okay, we might know healthcare assistants as HCA, healthcare aides, community healthcare workers, personal support worker, or even caregivers. Okay. But we have a misconception here in the Philippines that when you're an HCA, you only take care of the elders. Actually, there are a lot of opportunities for HCAs. They're not limited to just taking care of the elders. You can also take care of children. You can work in the hospital setting as well. So it's not limited to just being in the aged care facility, okay? And I believe this has already been mentioned. Healthcare assistants, they're regulated profession. You have to be registered in the BC Care Aid Registry. So there is a a registry that is established by the Ministry of Health, and the goal here is to ensure that healthcare assistants are adhering to a standard of care. And this is for the protection of course, the HCAs and the patients, the residents, and the clients. We did a research before the pandemic, and we found that the demand for healthcare assistance is continually increasing, and by 2024 there would be over 16,000 job openings for it. But what's happening right now is that there's over 18,000 job openings for healthcare assistants, so there is a high demand for this profession. Okay, so these are just some of the duties for the care aid work when you work in a healthcare or in a home care facility. Okay, so basically you're doing the first aid. Okay, if you're working with the elderly, so these are some of the things that you'll be doing. Okay, for earnings and employment, we have, as you've seen earlier, the job posting at $25 per hour. On average, a registered healthcare aide will be earning around $23 an hour. So that is really good money as a healthcare aide. And at Stenberg College, we have a lot of partners. These are just some of it. Okay. And when we talk about Fraser Health, we're also talking about different clinics and different hospitals. And again, Sir Israel's hospital, where he's working in, he's also our partner. So they're also looking for healthcare assistants. So let me just show you this video. This is a video of our graduates. Okay, they already did their co-op, and they were actually absorbed by our co-op partner. So this is a really good video. There's a Filipino here. All right, so I'll play it. It's just about 5 minutes long, and then we'll proceed with the presentation.
I have nothing but respect for the healthcare assistants, because if it weren't for the healthcare assistants, the nurses don't know the patients or the residents the way that the healthcare assistants do. They are the first line of defense, if you will. They come to you and they know when your patient is having any kind of a bad day or a good day. They know them way better than I do as a nurse. And so I 100% depend on the healthcare assistants to come to me with whatever needs to be done for that patient. What I first noted about Stenberg College right away when I started here was that there are so many resources available to the students, and the faculty and the school itself really cares about the success of Stenberg College students. What particularly impresses me about the HCA program here is the in-depth and breadth of knowledge and curriculum that is taught. It's not only just the provincial curriculum that's being taught, but it goes further so that the healthcare assistants can understand the diagnosis, not just what to do when this person has this. If they fully understand it, then they're going to do better in their career.
Our HCA program, I feel, is one of the best because of the simulations lab, the nursing lab, the way that they have integrated the nursing instructors to be able to have them in the same classroom, sometimes in the same lab as nursing students. So they have that cross-pollination of information with each other.
I get really excited when I teach, and I'm sure some of my students, if asked, would say this about me. I'm not just talking about diabetes, for example. I get involved in the background of it and then how to care for said person with diabetes. And so what I hope to pass on to my students is to get excited about it and not just treat it as just a job. It's not just a job that pays the bills. You're helping people, you understand, you do this, and this is the rationale for it. And to be able to help people, and not only the patients, but their family and their extended family and the colleagues that you work with, I think it's really exciting for me, both on the floor, nursing, and to instill that into my students. What I like my students to take away from the classroom, not only into their clinical, but into their careers, is the ability to believe in themselves and that they really are making a difference.
Growing old is inevitable, I suppose, and from my point of view, I just do the best I can for myself and for other people. I really think that here the staff are wonderful, and I'm just thankful that I'm in a place like this.
Before the HCA program, I was a housewife and I have regular jobs, but not a career.
Coming to Canada, I have like big dreams. For a starting point, it is very hard. I got like little bit confident. Okay, I can work in a gas station, and I started working there. But you know, going and coming back, it's the same routine, and then it's just stuck. The life is stuck.
My life before this, I was a digital designer. It was just hard to deal with contract jobs and not knowing whether if I'm able to support my son next week.
When I first started, all over it was a good experience, but I did have some obstacles. With the extra help from Stenberg staff, I pulled through with success.
We work together. If there is any kind of problem, personal problem, or about the education, so we work together, and so that everybody is fine.
We were given all the tools and all the skills that we needed to have in the real world.
Now, I got more confident that I can do better.
All the comments I got from my preceptor, they said it did not feel like they're working with a student. It felt like they are working with another HCA.
Iris called me one day to come for an interview. And then I got the job.
I have a stable job where I have income coming in, which I love doing. And then with that, I can also invest into my hobbies, which is design now.
I love working with elderly people. I love making a change, giving my minute or two and talk to them, make a difference in their life.
Having this job is perfect for me.
I remember one time I did go back, even though I was already off clock. I went back and went to see one of the residents. And just seeing their faces react to you, even coming back to them to talk to them, it's just rewarding. Not only it feels right, but it just, you're happy, knowing that you're making other people happy. I have a feeling that eventually people are going to realize this is a good, perfect career choice.
I have nothing but respect for them.
Okay, so there you have it. That's our students who got absorbed by the co-op employer. So they're already graduates. So this program, let's talk about the program. This program is a diploma program. So you'll be studying around 20 to 25 hours per week. So it's only half day. It really depends on the schedule, depends on the intake. So there are schedules like Monday to Friday, half day only, or maybe Monday to Wednesday, full day. So it really depends on the intake that you get into. There is a co-op of 20 hours per week. And when you study this diploma program, as you can see, there are additional certificates that we embed. Normally, these are some of them you'll be studying online and you'll be completing it. And it's an add-on to your qualification. So this program is 1 year and 2.5 months in duration. And within that 1 year, 2 months, there's 6 months of paid co-op. Okay, so there's a lot of practical component to it. This year, we still have October 12 for the intake. I believe you can still make it. It's July, August, September, October. If you're quick to complete your documents and to lodge your student visa, you will still probably make it for October. And if not, we have the next intake, March 14, 2022. Now, who can qualify for this program? Okay, so we're looking at year 12 equivalency. So when we say year 12 equivalency, we're talking about K-12 graduates, okay? If you've graduated K-12 recently, then you qualify to enter the program. If you're coming from the old curriculum, you studied up to 4th year of college, and then you went 4th year high school, and then you went to college. As long as you have completed your 2nd year of college, okay, it can't be incomplete. You have to have completed 2nd year of college in order for you to meet the year 12 equivalency. Or You might already have a bachelor's degree, okay? It's okay, you still qualify for the program. We will accept even if your college degree is a medical or a non-medical background. So for the English requirement, we're looking at if you have it, okay? Again, if you have it, general or academic. IELTS of 6.0, overall score, no band lower than 5.5. Now, just to enter this program, this is only for Filipino citizens. If you want your IELTS waived, we can do that. You just need to submit an English as the medium of instruction certificate. You can get this from your last school attended, okay? But just to also highlight this, if we waive your IELTS, okay, you will still be required to take an English exam before or maybe after when you arrive in Canada. Why do we still need that? Because this profession is regulated and it's not the school asking for it. It's actually the BC Care Aid Registry who requires the English proficiency test done. So you do have the option. When you arrive in Canada, you can take CELBAN, CELPIP, IELTS, TOEFL. We will give you instructions and we will give you links where to sign up. When you're there in Canada, let's say we waived your IELTS and you arrive in Canada, what we find is that IELTS, general IELTS, would be around $300. CELPIP is actually cheaper. It's about $180, and CELBAN would be around $100, around that much. So we're not just sure. That might change next year. If there will be any changes, it would be just slight change in the fee. All right, so it's your option whether you want to do your English test before you go to Canada or when you arrive, and we will be assisting you with that. So I've listed the tuition fee here. For the Healthcare Assistant Diploma International, the total tuition fee is $15,800. That's really competitive. If you take a look at similar programs offered by other schools, you will see that this is on the lower end. It's very affordable. Now, we don't ask for the total tuition fee. We only need the initial deposit of $5,150, and this is to secure your slot, to enroll you into the program, and for you to receive your letter of acceptance. Okay, the letter of acceptance, or the LOA, that is what Roman and Associates will use to apply for your student visa. Now, this is deductible from the total, so that means that you have approximately $10,000 left as a balance. That will only be paid when due to be paid when you arrive in Canada, and it's paid per installment. Okay, so it is paid per quarter. It would be around $2,000 plus per quarter. And if you need to customize your payment plan, we can do that. Just let us know ahead of time. Now, if you join the October 12 intake, currently we're running this promo that we can waive your registration fee. We're at $400. So that's still savings for you. So let's just cover this immigration pathway quickly. I mentioned we are a private institution, which means that you will not be eligible for PGWP. Again, I repeat, there's no PGWP, but we're not afraid with that because our programs, the programs that we offer, has an immigration pathway. So that means once you accept a work sponsorship, you will still be eligible to enter PR pathways. Okay, so the PGWP is not needed here because our students transition from student visa to work visa. As you can see, our employment outcome for HCA is 100% because students get the offer even before they complete the program. Like right now, we have students currently at HCA given, multiple offers. They don't know what to choose. Right now, it's like that. There's a lot of employers offering them work sponsorship and they're not even graduates yet. So that's a normal thing for us. But, we're being realistic and we want to be prepared for any circumstances. So let us just say you don't get an offer. Okay, that is very unfortunate, and our 100% will change, but let's just say that happens. What's your option? You still have a stay back option because Stenberg College will be providing you with an LMIA. So we will provide you with a temporary work visa, and we will pursue long-term work sponsorship for you. So you don't really have to worry about employment. And again, that's just a backup. We haven't used that backup because we have 100% employment rate for HCAs. So the admission process, I'm not going to discuss that anymore. You just need to submit your resume to Rowan and Associates, and they will be taking care of your application. And just lastly, before I end my presentation, I just want to cover the COVID-19 readiness plan. So if you want to check us out, we are an approved DLI, okay? And you definitely can travel. The border is open for you. So for those of you, because the travel protocol is continually changing, for those of you who are fully vaccinated with approved vaccines by Canada, you don't have to go through a quarantine period. Okay, you can just take your test prior your travel and take another test when you arrive. You can even do a home test kit. But for those of you who do not have the vaccine, or you're not fully vaccinated, or your vaccine is Sinovac, which is not accepted by Canada, then you have to go through a quarantine period. We will assist you in terms of arranging your airport pickup and transfer, and we'll take care of your groceries, your food during your quarantine period, just to help you out a bit while you're, adapting to your new environment. So there you have it. Thank you very much for listening to me. Back to you, Sir Israel. Thank you very much.
Thank you, Mom Janica. Let me just... So while I'm flipping the screen right now, so for our attendees out there, it is your time now to go ahead and ask your questions, and just type them in the chat box or the Q&A. And again, Mom Jenica, thank you. That was a very informative session. So yeah, so learned a lot of things again. There's always new things. So yeah, especially the COVID-19 preparedness. It is an ongoing change, right? So it's every day there's some new things happening. So yeah, so let's go ahead and check the chat box right now. So the first question is there any age limit? So for age, this is a very great question, and it's a very common question. So when we go to the immigration policy, the regulation, there is nothing, there's no indication of, for a study permit, you need to be from between this age to this age. So in terms of age limit, there is no age limit, right? So you can be a mature student, and that is fine. We just need to have a good learning plan or a statement of purpose on why would you study healthcare aid being a mature student. So Roman and Associates will be there to help you with that one. So, but short answer, age limit, there's no age limit. Next question is, good morning. How about healthcare assistant graduate from TESDA? Are we still qualified to avail this program? Yes, you are. I mean, there's few things. First, it is, yes, if you're a graduate of TESDA, yes, that's good, right? That's good to have. And in terms of, are you qualified? We have to go back to your high school, right? So if you are a part of the K1 to 12 curriculum, then you are qualified with the with TESDA or without the TESDA. If you are part of that if you're not included in that K1 to 12, you need to have completed your second year college. If you have completed your second year college with or without TESDA, you are qualified. But if you haven't completed your second year college and you are in the old curriculum, even with the TESTA, you won't qualify, unfortunately. Is that correct, Ma'am Jenica?
Yes, that's correct.
Trisha, if there's any follow-up questions on that one, please do not hesitate to just ask that follow-up question. I just want to make sure that I've answered your question. Next one is, good morning. May I ask if students are allowed to work while they study? Yes. So part of the study permit program by the immigration is that you are allowed to work 20 hours per week. So later on, when you are in your co-op part, you are already getting paid in your co-op. Plus, you can still work 20 hours on top of that one as part of your study permit. And also on this one, maybe I can just go ahead and touch it. In terms of the wage, even though you are a working student, your wage would still be at least the province minimum wage. It won't be lower than that one, right? So it could be higher, but definitely not lower than that one. Not because you're a student, you're a working student, your wage will be lower. No, you'll still the employers will still need to pay you at least the minimum wage. Okay, so that's for the chat box. Let's go to the Q&A. Okay, so for the Q&A, is this program study now, pay later, or we need to pay for the whole tuition fee in order to study? So yes and no. So the first one is study now, pay later. Unfortunately, because of the how low the tuition fee is, and with the amount of programs, I mean, like the amount of modules, courses that will be given to you, Stenberg College is not able to offer a study now, pay later. But when it comes to paying the tuition as a whole, initially you'll only have to pay the down payment, which is 5,000 plus, and that is to get you started for your study permit application, so that you will be able to get your letter of acceptance, which we need as part of a requirement for your study permit application. Now, the balance of the tuition fee would be paid when you are here in Canada studying in Stenberg, and it would be paid in an installment. And as Ms. Jenica mentioned earlier, if there's any challenges in terms of what has been set, you can always talk to Stenberg, and they'll be able to kind of like work around your needs. Next question is, I have IELTS, but it was expired already. So I guess the question here is, do you need another IELTS? So it's up to you. I mean, like, you can go ahead and retake your IELTS while you're in the Philippines, or you can take it when you're here. At the end of the day, you will still need a valid IELTS. And again, it's not for Stenberg. It is for the BC CareAid registry, right? In order for you to be registered as a healthcare aid with the registry, you need to have a valid IELTS. So that's good that you have your IELTS already, right? I'm pretty sure Stenberg College will be able to use that one to kind of like waive the IELTS for now. But again, later on, once you're here in Canada, you will still need to take your IELTS.
Yes, sir, I just want to
Go ahead.
confirm what you said, that yes, just submit that IELTS even if it's expired, and we will accept it. And then again, you just need to take it when you arrive in Canada. So no need for you to retake just for the school's purpose. Okay, we will accept that expired IELTS. Thank you.
No worries. Next question is age limit. I'm pretty sure, Elizabeth, this one was already asked, so I'm hoping that you did hear the answer earlier. Short answer is there is no age limit. And there's another question right below from Joanne. And the answer is yes, there is no age limit. And next question is there a show money for this pathway? Very great question. So yeah, so when it comes to the study permit application, the show money is also called as the living expense. So you will need to be able to show that you have funds to support yourself and at the same time to pay your tuition fee. So we already know how much your tuition fee is. For the living expense or the show money, you'll need to be able to show that you have liquid assets between 14,000 to 15,000 Canadian dollars. When you look at the website, the IRCC website or the immigration website, it would show there, you'll come across saying living expense is 12,000. But we advise our clients that we would like to not just be at minimum, we would like to be above the minimum so that it will really have a stronger application when we submit it to the officer. So yeah, so in terms of the show money, you need to be able to prove that you have your money to pay your tuition and at the same time liquid assets between 14 to 15,000 Canadian dollars. And in added information on this one is you don't need to have the money in your own bank account. Okay, you can have, let's say your parents are sponsoring you for this one, or your friends or your uncle or your auntie. They don't need to transfer the funds to your account. What will happen is we'll use their financial situation, we'll use their financial statements and submit it to the immigration with the letter of support from them, and that should be okay, that should be fine. Okay. Next question is, what is the age limit? And the answer to this one is there is no age limit. And I'm pretty sure you've heard my answer earlier. Yeah, short answer, there's no age limit. Elizabeth, if you didn't hear the full explanation on that one, just let me know. I can go ahead and touch base on that one again. Next question is, how about college graduate and caregiving with NC2 from TESA graduate? Am I qualified? Okay, so I'm thinking college graduate, at least this is a 2-year associate degree or a 4-year course or program. With or without the NC2, you are qualified. So that is the short answer to that one. So again, if you have completed your 2 years in college, you don't need to have NC2 in order to qualify for the program. It's good that you have it, but it's not a requirement. And not to put our NC2 or TESTA program down, but the NC2, you won't be able to carry that one to other countries to work as an HCA. It's not accredited towards working as an HCA, right? So you cannot show that one to BC Care Aid Registry and register for the healthcare aid to be registered, because they won't honor that one. It's different with Stenberg. With Stenberg, the program that you'll be taking and complete, that certificate can go anywhere. You can go anywhere with that certificate and it will be credited or acknowledged. Next question is, I have a son, 18 years old, just graduate K-12 program. Can he enroll in this program? Yes, definitely. If he is part of the K1 to 12, definitely he can enroll in this program, right? This is a good plan in terms of if the family wants to immigrate here to Canada, your son can do it for you. And just an overview. So he will come here complete the HCA program, be on a work permit, and then be a permanent resident later on. And once he is a permanent resident, then he can sponsor you and his parents as to come here to Canada as a permanent resident. Next question is, how many working hours for the dependent spouse, for example? So there is no maximum hours for the spouse. You can make your spouse work as much as you want while you study. So if you want your spouse to work 24/7, that is totally fine, right? So yeah, short answer, there's no maximum hours. As long as how many hours he can work, that's fine. He can go ahead and work as many hours as he wants to or as he can, right? Next is, hello, how long is the processing and when is the earliest start of the class? So the first one is in, did I say October, Ma'am Janica?
October.
Yes.
October, yeah.
So that is the soonest one, October. And the next one is March of next year.
March, yeah.
How quick? As soon as we submit, so this is from the time we submit the study permit application with the immigration, it would be only a month, right? And sometimes it's quicker than that one. So it is it is tight, but it is possible still, right? To if we can get everything sorted out as quickly as possible, like get your resume and then you submit all the forms that you need to apply for admission, and then we submit your study permit application, then yeah, there's a possibility that you'll make the September one. But if not, I mean, like it's not too bad to spend Christmas, right, in the Philippines and come in March. Next is living accommodation free. Okay, so for this one, unfortunately, the living accommodation is not free. And the only thing that the only advantage that Stenberg has is that Stenberg is in an urban area, Surrey. So in terms of the accommodation, it's not as high compared to living in Vancouver. Even though Vancouver is only like minutes away, like 30 minutes away or even 15 minutes away if using the train, it's lower. So yeah. And there's a lot of questions around expenses or financial things, right? So maybe I can just give you, maybe it's hard to realize right now because there's a lot of information going in your head right now. But when you're here in Canada studying your HCA course, you are allowed to work 20 hours per week. Okay, so 20 hours per week times, let's say, $15 an hour, right? So that would be additional income for you, right? For your expenses for that week. Once you are on your co-op, right, you are now earning like what the other healthcare aides are earning. So the average is $23 per hour, right? Or if it's in our hospital, it would be around $25 per hour. So what I'm trying to say is that even though you have expenses, you have means of paying those expenses, and not just your daily expense, but if you went to a bank to loan the tuition fee, you will be able to pay that one, right? In even before you finish the course, you might be able to, there's a great chance that you already have the money to pay your loan, right? So at the end, when you complete your program, you're debt free. Whatever you're earning would be your net income, right? So yeah. What course available for study? So there's a lot of programs available from Stenberg, but with this one, we are focusing on the healthcare assistant. If you are looking for other programs, Rosaline, just let us know, and we'll help you on that one. We'll try to see what would be the best program for you. How much is the show money if there is a dependent spouse partner? Okay, so great question. So for yourself, right, we were asking between 14 to 15, right? Now, if you're bringing your spouse, you'll need to add another 5 grand. If you are bringing a dependent on top of your spouse, you'll be adding another 4 grand, right? But it will be very tricky, really, to convince the officer that you'll be able to be successful in your program, knowing that you have your spouse and your dependents here with you, right? Because what we advise, what our common advice is that as a student, just come here by yourself for now, right? And then settle. Once you are settled, then you can ask your spouse or your dependents to apply to come here. Or better yet, just go ahead and complete the course. In that way, you can go ahead and focus on your course, on your program. Even, I mean, like, this program is Stenberg is not just a school out there, right? Like, I'm sorry, like in the Philippines, right? It is a school that has high standards. So definitely you need to study, you need to work your way in order to succeed in the program, right? You're not paying for the certificate. You are paying Stenberg in order for Stenberg to provide you quality education. And that's what Stenberg will be doing, right? So it might be hard if your mind is kind of like on different directions. I would encourage, come here, focus on your HCA course, work between your non-school days, and then next thing you know, you've already done your course, your program, and it's time for your family to come over. Okay. Next question is, how much is the tuition fee? Ma'am Jenica, how much is it again? The exact.
So the tuition fee is 15,000. Okay, 15,861. That's the total tuition fee. And then the initial is just 5,150.
Perfect. Thank you. And again, the tuition fee, the down payment, that's the only thing that you need for now. Once you are in Canada, the rest will be paid in installment.
Yes.
And this is another great question. If, for example, you have already graduated from your program, is it possible you can move to another location in Canada? Definitely, right? You can, but I'm hoping that once you graduate, you come to the hospital that I work, because I need care aides. I need you guys. So I'm hoping that you'll just come to our hospital here in Nanaimo, right? But then, if pretty sure there might be family living outside of British Columbia. Yes, definitely you can move anywhere in Canada. You're not trapped here in BC. The only thing that you'll regret later on is that BC has the best weather in Canada, right? So it's almost the same weather as California. We're close to California as well, to Seattle. So and we'll have I think we are planning to have our winter games, Olympic winter in Vancouver. So that'll be exciting. So yeah. Next is, how much is the estimated total initial cash out for this program? All fees, initial tuition, processing, visa fees, and medical, etc. All right, very great question. So what I would suggest for everyone is that once you, after this webinar, if you're interested, please email your resume to assessment at romancis.ca, and then we will we will respond to that email and provide you with all of the summary of this webinar as well as all the fees included. And I'll go ahead and type it in as well. There you go. Oh, no, let's type it to all. Sorry. There you go. Okay. Next question is, good day. Yeah, hi there. Would like to confirm if the tuition fee is full paid before leaving Philippines, or just have to pay the initial, then the rest will be paid in Canada. Yes, so the initial down payment will be around 5,000 plus. That is the only thing that you'll be paying for your tuition fee while in the Philippines. Once you have paid that one, you will receive your letter of acceptance. Once you are here in Canada, that's the only time you will pay the rest of your tuition fee. And with that one, you're not paying lump sum as well. It would be in installment basis as well. So only the initial down payment while in the Philippines. And once you're in Canada, the rest of the tuition fee, and again, in installment. Next question is, do I have to submit a high school diploma and Form 137 if the evaluation of ECA was secondary school diploma and diploma 2 years? I'll leave that one with you, Ma'am Jenica.
Yes, we don't need any of your high school credentials unless you are a K-12 graduate. So if you're a K-12 graduate, we would need your transcript of record and your certificate and diploma stating that you've completed K-12. If you're coming from the old curriculum wherein you graduated high school and then you completed second year of college, we don't need your high school diploma anymore. We just need the that you have your transcript of records and your certificate stating you've completed second year of college. We don't need any, ECA evaluation. We don't need any of that. So transcript of records, diploma, certificate, that's all.
Thank you, Ma'am Jenica. And hang tight. There's one more question for you. How long is the program to be completed? I just want to make sure that I give the right answer. So I'll leave it with you.
Yes, so it's a 67-week program. So that's 1 year and 2.5 months. All right. And within that duration, there's 6 months paid co-op. So it's the short one. Yeah.
Thank you. All right. Next question is, where can we apply for the program? So very great question. So please, after this webinar, please go ahead and submit your resume to assessment@romancis.ca. Again, it's assessment@romancis.ca. And we'll go ahead and start the process after that one. So we receive your resume, Stenberg College will evaluate your resume, and then we'll go ahead and give you all the list of supporting documents that you'll need so that we can go ahead and submit that one to Stenberg for admission, and it just goes on. So the first step is right after this webinar, go to your email and type in assessment@romancis.ca and attach your resume. And there you go. We'll go ahead and start the process that way. Next question is it okay to have a one-on-one consultation with you? Most definitely, Jesse. So please just message us on our Facebook Messenger or even on our email. You can email us in assessment@romancis.ca. Just attach your resume as well, and then just in the body of the email, just say that, hey, you want to have a one-on-one consultation, and we'll go ahead and book that one for you. So someone from one of our staff from in our Lipa office will take care of that one. Is there a possibility? Is there possible you will be denied on application and refundable, not accepted? Okay, so there's two things here, right? So one is that there is no immigration consultant that can say your application will be 100% approved. No matter how good your application is, there cannot be any immigration consultant that can say that, yes, you'll be approved, because we don't control the decision of the immigration officer. It is, at the end of the day, it is the immigration officer that would be giving or sorry, denying the visa. What we can do as an immigration consultant is we make sure that you have all of your documents to support a very strong application. So that is all the documents, making sure that it's complete. Your statement of purpose, or why do you want to come to Canada and study HCA, we'll be formulating a letter for that one to the officer. So yeah, so that is our responsibility, is to ensure that you have a very, very strong application. Now, in terms of refunds, and let's say, unfortunately, even after submitting a very, very, very strong application, you still got refused. Normally, what we would do is we would request for the actual transcript or notes from the officer and see what did the officer see or not see on your application that made him decide to refuse the application at that time. Once we have that one, we will go ahead and resubmit the application, answering the deficiency that the officer found out. If you won't, in case you would not proceed with that one, you would just say, okay, never mind, I'm okay, I won't reapply. The down payment that you have paid Stenberg, that one will be refunded to you, okay? Except the application fee that was waived initially. And anything to add to that one, Miss Ma'am Jenica?
Okay, so for the school, let's say you already paid your initial deposit for you to process your student visa. The 5,150 is actually refundable in case you don't want to pursue anymore, but there will be a $400 retained there. So 5,150 minus $400, and that will all be refunded to you. But again, I would also recommend that you try again. Just find out those notes and try again, because from my experience doing this for almost 10 years, sometimes you just need to try one more time and you get, approved. So I hope you don't lose hope when you get a refusal, because I'm pretty sure Roman and Associates will be able to overturn that once they know the exact reason for the refusal. So that's it. Thank you.
Thank you. So what does co-op means?
Okay, co-op, I'll answer that. Co-op is the cooperative work experience. So it's when you are placed with an employer to practice what you've learned. So here in the Philippines, tawag po dyan, OJT, on the job training. O kaya naman, ang tawag dyan, internship. Okay, so it's part of your program. Okay, it's a practical component so that you get to practice what you've learned, because your profession, okay, there's a lot of practical skills you need to apply. So co-op is needed so that you can practice what you've learned. Okay, so that's 6 months of co-op and it's paid. Cooperative work experience. Thank you.
Thank you. Next is, I'm sorry I entered the webinar late. That's totally fine. There's things happening in our own lives, so that's totally okay. Yeah, I think you're the one who asked if we can have a one-to-one consultation. So yeah, so we'll go ahead and help you with that one. Next is, how about the travel fee? I guess you are talking about plane ticket. If you're talking about the plane ticket and the question is who will be shouldering that one, that would be the student. If that is the wrong question, please, Rosaline, just go ahead and clarify your question. But yeah, if it's just, if it's the plane ticket, that would be shouldered by the student. Next question, going to the chat box. There was a question answer. It's 15K Canadian dollar total and then 5K Canadian total initial. Okay, so if you're referring to the total tuition fee, yes, it is slightly above 15K, but out of the 15K, 5,000 will be your initial down payment, right? So you paid the initial down payment of few more hundreds above that, 5,000 above that one, and then the rest would be paid in Canada. So 15 minus 5, so it's around 10 grand. A bit more than 10 grand would be paid in Canada installment. And is there anything else? Did I miss anything, Miss Mom Jenica?
Maybe in the chat box. I think there's a question about the dependents. But you've actually answered this already. When a foreign student apply, will they be able to bring their dependents? So I think that was already addressed earlier. Yeah, I think the other questions are repetitive in the chat box, so we were able to answer it. Yes.
Perfect. Okay, so I guess can we, okay, on the Q&A, going back to the Q&A, can you repeat, where can I submit the resume to be assessed? Okay, yes. So please just email it to assessment, so just the word assessment, at Roman, which is my last name, Roman, CIS.ca. Again, assessment at Roman, ROMAN, CIS.ca. Okay. Next question is, how much would the plane ticket fee be? Okay, so I haven't really gone into the website around plane tickets because there's nowhere to go. I cannot leave Canada with the COVID, so I'm not really sure how much the plane ticket is now, right? But and again, it depends on the season as well. So it could be as low as 600, could be as high as 1,200. So it depends. It depends on the plane, depends on if it's how many stopovers you have, and it depends on the season as well. But yeah, it could be as low as 600, it could be as high as 1,200. So yeah.
Oh, let me just add to that, Sir Israel.
Yep.
Right now, some of our students are actually traveling. So just to give you an idea, if you do a PAL direct flight to Vancouver in October, no, not October, August, it would be around 40 to 45K Philippine peso. Right now, it's a bit high just because it's already July, you know. So if you're traveling in October, that might actually be lower, and it's already a direct flight. I would really recommend you do a direct flight also because, you know, especially if you're not vaccinated, then you have to follow the travel protocol if you're going to, you know, stop over in a different country. So just keep that in mind. So I guess you having around 35 to 50K budget on a travel is, reasonable. Yeah.
Perfect, Mom Jenica. Just one favor, Mom Jenica. Can you make me the host? I'll just go ahead and
Oh,
share
I'm
the.
sorry. Yeah.
No, I'll just go ahead and share the screen so that they can capture it in terms of where to send their application.
Oh, there you go.
Perfect. Thank you.
Thank you.
No worries. All right, so on your screen right now, you can go ahead and take a screenshot of it. So send your resume to assessment@romancis.ca, subject line assessment for HCA at Stenberg College. So go ahead and screenshot, and there you go. So you have it on your phone. And with that, I think we can go ahead and conclude this very informative and very engaging webinar. What do you think, Mom Jenica?
Yes, thank you so much, Sir Israel. And thank you for all the attendees today and for asking your questions. We're really happy to be asking your questions. And I guess before we end, I just want to say you already did the first step. Okay, so do not miss this chance because Canada is really in need of healthcare assistance. So do not prolong it. If this is your plan, do it now. So we look forward to your applications. And again, Sir Israel, thank you so much for inviting me. Thank you.
And once again, Mom Jenica, thank you so much for allowing me to have you in this webinar. And with that, have a good day, everyone. I'll wait for your resumes.
Thank you. Bye.